Thank you for joining us for another episode of Scientifically Speaking in conjunction with Practical Dermatology and Modern Aesthetics magazines. I'm Dr. Joel Cohen from Denver, Colorado, and I am excited that in this edition of Scientifically Speaking, we are going to be talking about sunscreen and photoprotection with Dr. Teresa Michel from the Food and Drug Administration, as well as Dr. Steven Wang from Memorial Sloan Kettering. With me now is Dr. Steven Wang from Memorial Sloan Kettering, and I've known Dr. Wang for a long time, and many of you know him as well. He has been a relentless author on photoprotection, publishing in JAMA and Journal of the American Academy of Dermatology. He's written a textbook on photoprotection, a textbook on melanoma, as well as a textbook on nanoparticles in dermatology. So we're going to touch on some of these topics today. And Steve, it's really great to have you join us.
Joe, thanks again for inviting me to your series.
Thank you. So there's been a lot of discussion about coral reefs and sunscreens, in particular some ingredients like oxybenzone and octinoxate. And from a perspective of real data from in vitro studies that have been done and translating that to concentrations that may be seen in oceans and the reef, can you talk to us a little bit about some of the issues pertaining to these ingredients and whether, in some cases, people may have sort of jumped the gun based on very preliminary data?
No, you asked a really, really great question. In the US, there are about 16 UV filters that have been FDA approved to use in the sunscreen. The two UV filters that's in questioning, that's possibly affecting the coral reef is oxybenzone and actinoxate. Both of them are considered as organic or chemical sunscreen. The oxybenzone is both a UVB and a short-range UVA filter, and it is widely used in lots of sunscreen that you've seen in the market. Actinoxate is one of the very useful UVB UV filters, all right? Now, most of the data is mainly coming from in vitro laboratory studies where they sort of exposed coral reef in a sort of a tank, and then they added a dose of those two UV filters at a much higher level than that is available, readily available in the ocean, let's say from human exposure for passing on from the sunscreen into the ocean. And they demonstrated, this is toxic to the coral reef. But I think any times that when you have those kind of evidence, any kind of the data, like you said, people tend to jump the gun and start thinking that this is a major contributing factors. And one of the things I think when we talk about sunscreen, any of those topics, we have to understand the difference between risk equals hazard times exposure. Right? And just because you have demonstrated there's a potential hazard, it doesn't mean in real life setting, and this is the culprit, this is agent that's going to cause the coral reef. And you have to also factor in the exposure level. Right? So if we think about this, any kind of drugs we use, there's some sort of therapeutic windows, and you have to dose it correctly. And like, for instance, if water, for instance, is a very innocuous substance, but if you submerge an individual under water for a long period of time, it can do damage. The same thing, and this is what's going on right here.
So if we're really taking what happens in a clinical lab where they're looking at ingredients and they're looking at concentrations of those ingredients, from a practical standpoint, if we had a boat with 20 people on it, loaded up with sunscreen that jumps into the coral reef, and assuming that it's just not a windy day and they're at that reef for a period of time, is it possible to actually reach that concentration from these laboratory experiments with these types of sunscreens?
I think it's very difficult. And you can imagine that, first of all, you step back and you really think about this. Most people, first of all, don't use enough sunscreen, period, right? And in the label, the guideline basically says put 2 milligrams per centimeter square. for an average adult, it's basically a shot glass of sunscreen to cover the whole body. And if you really think about this, one tube of sunscreen, if you buy a commercial market, is about 4 ounces. So realistically speaking, if you use it correctly, you can only use it 4 times, right? But in reality, what's happening is, you go out there with your family and you're going to share it with everybody, and you're going to use it for the whole summer. By the time you finish, you still have leftover after the season. So that's, first of all, like, people are using it far less than reality. That's number one. Number two is, I think in the laboratory setting, there is a whole bunch of other issues. And I think one of the issues is, some of the other ingredient that's put into this to dissolve the filters, that may also have a negative impact on the coral. And also just the ocean volume, and I think it's very, very difficult. And I think here's a critical element that is, I can understand why the environmentalist people want to ban the oxybenzone octinoxate oxide, is very passionate about this because they want to save the coral reef. But the attention that focused on the sunscreen may be taking away the focus on the real culprit, which is rapid rising of the temperatures, right? And there's a couple of studies that's done that basically show that there are a severe bleaching event, meaning that you bleached coral reef over 30%, and 2 moderate events that bleached the coral reef less than 30% in this geographic area since 1960. They all related to extreme heat. So we know that rising global temperature is a major, major culprit that's causing the harm, right? So let's say, can sunscreen with the oxybenzone octinoxate oxide have any kind of effect? Probably very, very minimal.
So I think this is really helpful. We focused on some specific ingredients. There's also other ingredients aside from oxybenzone and octinoxate that patients frequently ask me about, and I'm sure ask you about, and other dermatologists. And that one being is retinol palmitate.
Sure.
So we use retinoids on a regular basis in aesthetics and in our skincare regimens, and even, from a prevention standpoint for people with actinic keratoses. And from a molecular structure, I know retinol palmitate is a little different, but it is something that is in some sunscreens, and there has been some criticisms of that. What's your take on the retinol palmitate controversy?
Yeah, this is a really interesting. I think that controversy came about, I think, in 2012, I believe. So the environmental working group at that time published, during the summertime, Memorial Day, they published some sort of information about sunscreen. And that year, I think they focused on retinol palmitate. As you mentioned exactly, the retinol palmitate is actually the storage form of the vitamin A. And we, as a human being, have that in the body, and etc. And retinol palmitate and other forms of retinol, vitamin A, has been used both in cosmetic ingredient and in sunscreen and in other kind of just anti-aging product. The evidence that came out of this was they pulled one of the FDA and NTP national, NTP was, I think, I forgot the exact nomination, but they're looking at the various photocarcinogenicities of various molecules. They didn't really isolate retinol palmitate. They're also looking at, for instance, like zinc, titanium dioxide, beta hydroxyapatite, even aloe vera, right? So the study basically looked at animals, mice, and they put the retinol palmitate on those animals, and they radiated light, UV light, over it with different type of dosage. And they really didn't find a statistical significance to demonstrate there is increasing carcinogenesis. But that information was released, and people became concerned about it. And my feeling on this, again, is I think perhaps it's overblown in a sense. Retinol palmitate is a form of vitamin A that has theoretical potential when exposed to the sun to create some sort of photoallergic reaction or phototoxic reaction, right? But I don't think it's enough that will prompt to cause any kind of skin cancer. In fact, if you look at retinol palmitate that's used in conventional sunscreen manufacturing process, the formulation, the level is very, very low.
So You know, when it comes to other ingredients that are
Sure.
generally regarded as safe and effective, we spend a good deal of time educating patients about zinc oxide and titanium dioxide and really covering further out in the UVA spectrum, and these being more physical sunscreens and mineral-based sunscreens. So let's take each particular one separately. From a titanium dioxide standpoint, you know, are you feeling comfortable about general recommendations for people to use that from kids through adults and, you know, applying to widespread areas of the body?
Yeah, so you asked a great questions. I know that you just interviewed the FDA. If you recall, in last year, 2019, and they issued some sort of proposed ruling. They put down titanium dioxide and zinc oxide as considered as a category 1, meaning that's generally recognized as safe and as effective. All right, those two ingredients. And so I think, for individuals who are concerned about absorption, who are concerned about chemical, and I highly recommend them to use sunscreen with titanium dioxide or zinc oxide. And what is also really interesting is, conventionally, if you think about those two ingredients, in the 60s and 70s, people using sunscreen made of titanium dioxide, zinc oxide will make your skin look pasty white. It's only in the 1990s when there's all these modulations and changes that are taking place. What they did is basically micro-sized and nano-sized titanium dioxide and zinc oxide. And by changing the particle size of individual those molecules, and you can basically create different absorption levels, right? So for instance, that if you create nano-sized TiO2 zinc oxide, you can shift the protection more towards the UVB range. So this is the advancement that's taking place, and that's what making some of those sunscreen nowadays less white, less like white and pasty. So create this aesthetic feeling that people like to use it. So even with that, I think it's a very difficult for people with Fitzpatrick type 6, Fitzpatrick type 5 individuals, like African American, Latin Americans, even some of the Asians, because you still will make your face looks a little bit white. That's the challenge.
You know, fortunately, when it comes to the white, I think a lot of people don't realize that titanium dioxide is something that's used in many makeup types of ingredients for color. So if you add a tint to things, and the fact that many companies have different spectrums of light tint to medium tint to heavier tint, you can avoid that sort of pasty toothpaste type look. So, from a standpoint of somebody who has spent a lot of time studying nanoparticles and microparticle sort of micro-sized ability, from a titanium dioxide standpoint, you feel very comfortable in this, and really the word needs to get out that this is a very safe and effective ingredient that is a broad spectrum ingredient, right?
Yeah, and one of the things people worried about nanoparticles, especially nano-sized titanium dioxide, zinc oxide, is the fear that those particles can actually penetrate the stratum corneum, reaching the epidermis because they're small particle size. And there are almost like 30s, 40s of studies that are looking at this. It shows no evidence of actual penetration, even for people with eczema. Barrier impaired individuals. The concern here is when you have nanoparticles and the UV light actually can interact with those nanoparticles and create free radicals, all right? But the manufacturer have since resolved that problem by coating those nanoparticles with some sort of shells around it, so restrict the release of free radicals. So again, the bottom line is it's safe because it doesn't penetrate into the skin despite the nano size. And second, there's a way to shield the particles to prevent the release of free radicals.
And then, when it comes to specifically zinc oxide, that's something that we've used on diaper dermatitis type formulations, which is obviously irritated skin where the ability and the potential to absorb is much higher. From a standpoint of FDA, that is something that's generally regarded as safe and effective as well. So when you're using zinc oxide and you're microsizing zinc oxide for elegance and rubbing in, your thoughts on that?
So again, I think I sort of consider the both titanium dioxide, zinc oxide in the same safety profile, basically. And I think, even when you're nano size, you make the size, different size smaller, there is still this potential of making the product white, basically. And I think, like you said before, it's very useful for those BB cream, the sunscreen with makeup was tinted, because you can add iron oxide, different level of iron oxide, to create the shade, to minimize that type of reduced or eliminate the white appearance. So that's perfect, right? But for instance, if you're using a product for active use, for on the beachwear type of product, and it is not, no one ever put those kind of color iron oxide into it, right? That is the challenge. That is the challenge for that type of active use sunscreen product.
So, it's a perfect segue that you mentioned iron oxide, because there's been some recent attention to that. So during this whole pandemic, clearly more people have been spending time on virtual meetings on platforms such as the one that we're using right now. And the thought was, are we seeing more people with pigment issues and melasma flares that may not be spending as much time outdoors? However, their pigment seems to be revved up. And the concern was blue light. So iron oxide, I know, is very effective at blue light. Very often we get questions about blue light after some recent media attention to that. So if you take into account some of the mineral-based sunscreens we mentioned, zinc oxide and titanium dioxide, how much better is iron oxide in addition to these things for blue light?
Yeah, it's a great question. I think some of those work was done up in Detroit. That's got to be more, maybe 5-6 years ago, when they basically irradiated people with type 5 or type 4 to type 6 Fitzpatrick skin type with both the UVA as well as visible light, right? And they were able to show the visible light was able to induce stronger pigmentation that will last longer in people with darker skin type. So that's where all this evidence came from, and sort of documenting that the blue light perhaps is more damaging in causing melasma, right? And that is also the same reason, your patient is coming back and they swear to you they're using sunscreen, but they still get melasma after the summer, right? So because all the sunscreen out there, especially the chemical ones, have virtually zero protection against the blue light range. Because most of sunscreen, the chemical range, only protects all the way up to 380 to 385 nanometers, where the blue light takes place over 410, 430, that range. Now, titanium dioxide and zinc oxide, the ones that's not make you white, do not have any protection across all the way to the visible light whatsoever, all right? And it's only, but so the problem is in the labeling guideline, if you look at the back of the sunscreen labeling, if you look at the active ingredient, all they say is titanium dioxide, zinc oxide. They tell you how percentage, but they do not tell you the particle size. So as a result, as a consumer, as a dermatologist, we have no idea if those products will actually protect all the way across into the visible light spectrum, right? So the only assumption is that if you put a product on that makes you look white, that will have a little bit of protection. And the iron oxide, those definitely have some degree of protection. They think that, some of the data I've seen, they give you protection about maybe 3 or 4 factors. That's it. So it's not strong protection. What we really need is a combination of those kind of like iron oxide that blocks a little bit of visible light. What you really need is antioxidant, right? Because that is, we think the mechanism behind this process of inducing hyperpigmentation is free radical generated mediated process.
So it's almost like we have sort of discussed, sun protection for everybody.
Yeah.
That hopefully will prevent skin cancer with the importance of using the right sunscreens with the right ingredients, applying it 2 milligrams per centimeter squared, and then reapplying, for water contact or sweating, and then we have a separate issue in terms of sun protection for pigment disorders, such as melasma and such as, many of these people that we see that have a tremendous amount of lentigines or overall photo damage. And it may actually even be easier if they have separate labeling for these. So you're really advocating, for these pigment disorders, having sunscreens that are big enough that you actually see the white discoloration on the skin, such as zinc and titanium, and sunscreens in those cases that have iron oxide as well, and then to use an antioxidant. When would be the appropriate time to use the antioxidant, and then how do you incorporate retinoids in your regimen as well?
That's a great question. And I think you're absolutely right. I think so. So to answer the question about protection against skin cancer, right? And I think this is one thing I want to highlight. That is, as a dermatologist, we always talk about sunscreen, right? But I think we have to step back and really talk about the comprehensive strategy. And most people always talk about sunscreen. We only think about sunscreen as the first step of photo protection. But reality of the matter is, we have to think about, just reduced exposure, hats, and clothing, and shade. And I think very last, you start thinking about sunscreen. And I think clothing by far is far more powerful than sunscreen. We can certainly talk about that later. But in terms of pigmentation and how to use antioxidant, and that's also very powerful. There is different pills you can take. The two that has the most data on this, one is niacinamide, right? Because the large data that showed you can reduce the reduce actinic keratosis as well as SEC by almost 24%. But the other one, the people that talked a great deal about this is HelioCare, right? And this is a product that you can take, and that has about SPF 4 or 5, but it works through an antioxidant approach. And there's different way you can take it. You can take it like on baseline every day. You can take it as a rescue dose, and there's all this different way to take it. And then also there's, different companies are trying to make product that has sunscreen combined with antioxidant. One of the challenges doing that is it has to do with the formulation, because if you think about this, the sunscreen relies on the UV filter. You basically don't want to penetrate into the skin. You want to stay on above the skin surface. In contrast, the antioxidant have to actually penetrate, get into the living cells, and to make it work. So now you're creating a formulation. You want the UV filter to not go in, and you want the antioxidant to go in. That create a paradox, that create the formulation challenge. And, when we talk about when to use a retinoid and type of things, again, obviously, we always tell patients to use it during the nighttime, and antioxidant do using at nighttime. That's probably a better approach. If someone wants to layer this stuff over it, they can, I would recommend perhaps putting on, let's say, antioxidant serum or cream onto the skin first. So allow that antioxidant material like vitamin C or ferulic acid and to sort of allow it to penetrate. And then you put the sunscreen outside as a filter process.
So wrapping things up, that was a discussion that I wanted to have as well about sun protective clothing. I think, when we as a family, with my wife being a pediatrician and me a derm that does a lot of skin cancer, we show up at a pool or a beach or somewhere wearing UPF shirts and rash guards and wide brim hats and, lots of sunscreen and visible sunscreen, pasty sunscreen that you can see on. But I think that in general, people don't think about sort of that whole perspective. So obviously, seek the shade, number one. If you have the opportunity to sit under an umbrella, still wear a hat and sunscreen. That's been studied, but sit in the shade. Number two is try to pick your time interval that you're outside for sun hours and try to avoid that peak sun, 10 a.m. to 2 p.m. type of time frame. and then, wear a hat, wear sunscreen. But also, I think these shirts are catching on a little bit more, but it's not uncommon for somebody to come up to me and ask, about our sun protection. And whether it's at the pool wearing a rash guard or it's hiking wearing, a UPF overshirt over something, it's something that we've incorporated. How do you really get people to understand UPF ratings and the importance of really looking at clothing and seeking clothing that gives you this added level of protection?
Yeah, that's everything you said is right on, and you're so right about everything you're saying, and it's all the great advice for the patients, and set great role models. I think it's funny, every time you go to one of those dermatology conferences, you sit around the pool, who's a dermatologist, who is just the average resort guest, because the dermatologists all stay in the shade, they're wearing all this protective clothing. So we actually did the study about, 20 some years ago. And we actually basically, it turns out if you just wear a white t-shirt, that has a UPF about a 5, all right? And if you dye a t-shirt, we actually dye the t-shirt, white t-shirt, with some sort of color on it. And that actually has, I believe that had a UPF about 10 to 15, all right? That's really significant, because if you think about this, right, if you think about UPF, SPF about the same, let's say, a product that has SPF 30 needs you to basically put on 2 milligrams per centimeter squared, but most people, let's say they put a half of the stuff on. So the SPF product they only get is about 15, all right? And whereas if you just put a regular t-shirt on with some color on it, and that has UPF about 15, right? So that's good enough, actually. If you put a jean, a type of things on, that has UPF over 100 something. And so a lot of those clothings are made with special fabric, and they have polyesters materials and some sort of chemicals material that can actually absorb the UV light.
Steve, you probably see this as frequently or more than I do, but there are many patients out there that have a history of skin cancer that are still with a lot of misconceptions and misperceptions about a base tan. So
Sure.
Recently I saw a patient who literally came in for a preoperative appointment for a squamous cell carcinoma that was pretty sizable. It was on the ear, a high risk site. And I looked at them and they were tan, and I could tell that they had little like white marks in their frown lines and their squint lines, that they had really recent sun exposure. And I said, it's unusual for me to see somebody that is so much darker and tanner than they were at the time of this biopsy photo just a few weeks ago that I showed them. And they said, well, you'll never guess, we were going to Hawaii and we went to the tanning salon to sort of prepare our skin so that we didn't get more skin cancer. And then they were in Hawaii getting fried. So, I think that it really underscores that even among people that have skin cancer, there's still a lot of misperceptions. So, what do you tell people about base tanning, and what do you tell them about sun protection after they've had skin cancer?
Listen, I have so many similar patients, and I have patients with the melanoma when they come back for skin check and they're completely tanned. You're just like dumbfounded. I mean, like, didn't you remember your experience with the Mohs surgery? How did you feel? And just so many patients like that. And I think, there's a couple of elements in this is very interesting. One of it is like what happened is when you get a tan, and once you have UV radiation to the skin, and it triggers a induction of POMC gene. And one of the byproduct that kicked off all this is endorphin. So that is one of the reasons that people love going to the sun, because the endorphin it generates, it makes them feel good, right? And another thing is that any times I tell patients that, the mere fact you're getting a tan, the mechanism of generating a tan is the body's basically releasing this SOS message. That is, you getting DNA damage, and we have to basically produce melanin to shield the DNA. And that is the exact mechanism, right? And when you try to explain to people that the mere fact you're getting tan, you're getting DNA damage, which will lead to increased risk for skin cancer, aging, et cetera, they will nod their head and they says, But in reality is they will still do something else that's not really good for their health. And I think that element, the emotional element, the physiological element, the beta endorphin element, also this social status element is far more powerful than you and I can explain to patients. And I think we make decisions based on emotion, and we justify it later with rationalities. And you can't fight that. And the only thing we can do is, I try not to make them feel bad, and I try not to make them feel guilty. And you can only nudge them towards one direction. That's all you can do. And then here's one more thing. It's, they also say this to you. They says, I swear to you, I've been using sunscreen, right? That they swear to you. But the problem is when they go on a vacation, they take 1 3-ounce sunscreen tubes, again, share it with whole family, but they put it on, so they give them license to go out there to get 5 hours of sun exposure, right? So that's kind of wrong way of thinking that we have to reverse. And that's why you are so right, talking about how to prioritize the use of photo protection, right? Shade, right timing, hats and clothing, lastly, the sunscreen.
I actually talk to them about the fact that we are where we are. We can't Monday morning quarterback anymore. We just have to focus where we are and realize that suntan or that redness that they have right now is evolving sun damage on the spectrum of leading to a skin cancer. And we need to do what we can at this moment in time to halt that progression. And it's incorporating all the measures that we've just spoken about. So I think that there is this concept of, I understand where you've been. We need to just move forward in a different direction that's much more safe. And you have to be a co-participant in all of this.
Yeah, I think that's the right message, because it's a much more productive discussion, right? Versus trying to embarrass or make your patients feel guilty, and that doesn't build rapport. And I think what you're saying is the right approach. A lot of times I take the same approach.
Steve, it's been great having you join us for this segment of Scientifically Speaking. And I think you've added a lot of value in terms of, our discussion about ingredients and what we're looking for and understanding nanoparticles. And I think, really as two practicing physicians, both board certified and fellowship trained dermatologists seeing a lot of skin cancer every day, these are conversations that are very relevant. And ideally, it would be great if we got our patients to seek the shade and wear a wide brim hat and use sunscreen with the right ingredients and reapply every 2 hours and apply as much as they're supposed to and reapply if they're swimming or sweating. And I think from a practical perspective, this sun protective clothing is really helpful and important as well. So thanks for joining us, Steve, and thank you very much for all being with us for another episode of Scientifically Speaking in conjunction with Practical Dermatology and Modern Aesthetics magazines.